Coronaviruses are a family of viruses that range from the common cold to SARS and MERS. Not all coronaviruses are the same. This video addresses the 2019 novel coronavirus that causes the disease COVID-19. The goal of this video is to make you more confident on the correct use of personal protective equipment, PPE, in the care of a patient with or being ruled out for COVID-19. The CDC recommends the use of airborne and contact precautions, as well as eye protection when caring for patients with COVID-19. Contact precautions require gown and gloves. Airborne precautions require that staff wear a fitted N95 respirator mask, either round or duckbill. Choose the mask that you have been fit tested for. If facial hair impedes the seal of the N95 respirator mask, you will not be able to use the mask. If you have had significant changes in weight or hairstyle since your last fit testing, you must return to be retested. If you have questions or concerns about your N95 respirator mask fit, please contact the safety department. Team members will need to gather the following PPE prior to donning: gloves, non-permeable gown, correct fit N95 mask, and goggles. Peppers will not be an option when caring for patients with COVID-19, as they create barriers to optimal donning and doffing of contact precautions. Always do good hand hygiene before putting on PPE. You may use either alcohol-based hand rub or soap and water when caring for patients with COVID-19. No matter which method you choose, be sure to disinfect all surfaces of hands, including between fingers and around nails. Both methods of hand hygiene should take at least 20 seconds. As with any patient, please choose soap and water hand hygiene when hands are visibly soiled. Hands must be completely dried before donning PPE. For an airborne and contact precaution room, start with the gown. Make sure to fully cover your torso from neck to knees, arms to the end of wrist, and wrap around the back. Make sure the gown is tied and thumbs are through the thumb hole. Next, put on your N95 respirator mask, adjusting to ensure a good fit. We will start with demonstrating the round mask. Cup mask in your hand with nose pieces at fingertips and place over nose and mouth. Take top strap and loop overhead, placing at upper middle portion of the head. Then take bottom strap and loop overhead, placing at base of neck. Then form mask around bridge of nose. If using the duckbill mask, open mask up and cup mask in front of face and place chin into mask. Loop both elastic bands overhead, placing top band at upper middle portion of the head and placing bottom band at base of neck. Next, adjust bridge of nose and form mask snugly around face and chin. For both types of mask, the fit should be snug to face and below chin. Perform seal check by placing hands over mask, exhaling sharply and feeling for any leakage. Readjust as needed. Next, don goggles. Lastly, put on gloves and extend them to your wrist so there is not a gap between gown and gloves. You are now ready to safely enter the patient's room. Now that you are done in the patient's room, it's time to remove the PPE. Take your time and be careful. The gown front and sleeves and the outside of gloves may be contaminated. Grasp the gown in front and pull away from your body so that the ties break, touching outside of the gown only with gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into the trash and perform hand hygiene. Next, remove goggles without touching the front, as it may be contaminated. Next, perform hand hygiene and exit the patient's room. Note, you're still wearing your N95 respirator mask. Finally, remove N95 respirator mask. When doffing masks, it is crucial you do not touch the front of the respirator, as it may be contaminated. While leaning over a trash receptacle, remove mask by pulling the bottom strap over the back of the head, followed by the top strap, disposing of mask into trash. After removing mask, perform hand hygiene. Good hand hygiene practices and proper use of airborne and contact precautions will help keep you, your patients, and your fellow team members safe during the care of patients with COVID-19.